you to our webinar on domestic violence and COVID-19. Everybody will be staying on mute during this presentation. If you have any questions, please feel free to use the chat function that you'll see on your screen. As many of you know, October is Domestic Violence Awareness Month, and so we wanted to take this opportunity to give everyone in our audience a bit of background on domestic violence, and in addition, the added event this year on COVID-19 and how COVID-19 has impacted domestic violence in our communities. My name is Smita Varia. I am the Program Manager for the Montgomery County Domestic Violence Coordinating Council. And you'll be hearing from my coworker, Tom Mannion, who is the Director of the Family Justice Center, a little bit later on in this presentation. I wanted to start off by just getting a sense of who we have in the audience. So I just have a quick poll. If you all could let me know where you are from in Montgomery County, if you're from the Upper County, the Down County, Mid County, East County, or if you do not live in Montgomery County. So I'll give everybody just a couple of minutes to answer that question. All right, I will go ahead and share those responses. And as you can see, we've got most people from Down County, and we've got quite a few that do not live in Montgomery County. And that's fine because domestic violence doesn't change depending on where you live. So you will definitely, hopefully, learn something about domestic violence and COVID-19. All right, thank you for that. So today we're going to be talking about the dynamics of domestic violence. I'll be going over what domestic violence is, how it impacts people, the different types of violence, how it can impact children. I'll also be talking about warning signs for both the victim and the abuser. And then we'll be talking about how you can help somebody who may be experiencing domestic violence. And then Tom Mannion will be talking about domestic violence during COVID-19 and the Family Justice Center that we have here in Montgomery County. I did want to just let everybody know that we are going to be talking about violence and abuse, and it can be hard to hear and talk about. If you need to take a break, please feel free to step away. And if you need assistance, please call the Montgomery County Crisis Center at 240-777-4000. I have put that phone number in the chat. They're open 24 hours a day, 7 days a week to speak to an advocate. And they are a great resource for those of us in Montgomery County if you do need to speak to somebody. So what is domestic violence? I'd like everybody to take a moment in the chat to just chat in really quickly what you think domestic violence is. What do you think of when you think of domestic violence? And I don't see anybody chatting in right now, which is fine, which means that hopefully you will learn a lot during this presentation. I always see that somebody wrote that it's emotional abuse, that it's intimate partner violence or bullying, use of children or money to gain power, definitely. And emotional abuse, exactly. We'll be talking about both of those things throughout the presentation. The definition of domestic violence is that it is a pattern of behaviors used by one partner to gain and maintain power and control over the other person in an intimate partner relationship. Today, we're going to be talking about domestic violence as it pertains to intimate partner relationships. A lot of times, domestic violence also includes child abuse, elder abuse, But today we're going to be talking about those who are in an intimate relationship. I see somebody else also chatted in that domestic violence or abuse is physical, mental, financial that occurs in the family or on the part of a partner or family member. Exactly. So I wanted to share with you some statistics around domestic violence. 20 people are physically abused every minute in the United States. That is a very high number if you think about that we are going to be doing this webinar for 60 minutes, and if you multiply 20 times 60, that is statistically how many people will be physically abused. More than 1 in 3 women and more than 1 in 4 men have experienced rape, physical violence, or stalking in their lifetime. A lot of times we think that domestic violence and intimate partner violence is when the woman is the victim and the male is the perpetrator. However, as we can see here, it doesn't matter. The victim can be male, can be female. It doesn't matter what sexual orientation, what gender identity, in addition to what race you are, what religion you are, what socioeconomic status you are. It really does not discriminate. And also, we also think a lot of times that domestic violence just relates to adults. However, 1 in 3 teenagers between the ages of 14 to 24 in the United States is a victim of physical, sexual, emotional, or verbal abuse from a dating partner. So unfortunately, this does start in middle school. It can start in high school, where in an intimate partner relationship, in those ages, we call it dating violence, but it's the same thing as domestic violence, and it can start very young. And in Montgomery County, an average of 10 protective orders per day are filed in Montgomery County. When we say protective orders, you may know them more commonly as restraining orders. And these are the protective orders that somebody goes to court to file so that somebody is court mandated to stay away from them. And keep in mind that 10 protective orders may not seem like a lot. However, for a victim to step forward and to file a protective order is a huge step. And so those are the people that have this, that are able to come forward, whereas many, many more victims are still trying to figure out how to keep themselves safe and may not be ready to take that step to go to court to file a protective order. So let's talk a little bit about the types of violence. Usually, most people think about physical violence as domestic violence. So physical abuse being physical force with the intent to cause fear or injury. However, there are many other types of violence that I'd like to go over. Emotional abuse is the non-physical behavior with the intent to diminish the other's dignity or self-worth. This can look like intimidation. It can look like putting down somebody by using insults. It can be threats. It can be teasing them. It can be name calling. Anything where it's to lower the other person's self-worth or self-esteem. We also think of sexual abuse as a part of domestic violence, which is any action that pressures someone to do something sexually they do not want to do. That, of course, includes rape or sexual assault. It can also include unwanted touching, unwanted hugging, unwanted kissing, forcing somebody to watch pornography, reproductive coercion, which means that they may poke a hole in a condom so that they are intentionally getting somebody pregnant as a way to further control them in the relationship. In addition, technology abuse is a very common way for people to abuse others. It's by using technology and or social media to intimidate, harass, or control the other person. This may look like forcing somebody to give you their password so that they can monitor what you're doing on your phone. It could mean deleting contacts so that somebody may not be able to get in touch with a loved one or a family member. It could be tracking where they are on social media if they check into a restaurant or if they're at a friend's house and they're looking at their photos. It could also mean putting some sort of tracking device, GPS, or using all the plethora of apps there are right now to be able to track where somebody is at all times. And that goes hand in hand with stalking, which is, of course, being repeatedly watched, followed, monitored, harassed. It could be showing up at the person's work, asking friends and family constantly where they are, what they're doing, how they're spending their time. Again, using a phone or GPS in the car to track where they're going at all times. And lastly, financial abuse, which is using money to control the victim. And this could be anywhere from not letting them have a job so that they are financially dependent on you. It could mean giving them an allowance so that you know exactly how much they're spending on groceries or for the children. It could mean that they have a job and the perpetrator is forcing them to give them their paychecks to say, oh, I'll take care of the money, the bank statements, everything is in my name, don't worry about it. However, then you are completely relied on them in terms of money and finances. So those are 6 very common types of abuse. And now I'd like to talk about the cycle of abuse. Usually in a relationship, the abuse isn't 24 hours a day, 7 days a week, but it follows a very loose cycle. Now, I would like to say that sometimes this cycle doesn't exist and there is a lot of violence and there's no pattern, but research has shown that this cycle is somewhat what a lot of victims deal with on a day-to-day basis. So it could start with tension building. So there's tensions, they increase in the breakdown of communication, the victim becomes fearful, they feel like they need to placate the abuser, there may be a fight about some situation, the victim may feel like they are walking on eggshells around the abuser. What usually happens after that is that there is an incident, right? So this is where there's a physical assault, there may be a sexual assault, there's anger, there's blaming the victim, there's arguing, there may be threats or intimidation. After that usually comes, becomes the reconciliation. So usually what happens is that the abuser apologizes, they give excuses, they may blame the victim, they may say, well, I wouldn't have done that if you had done this instead. They may deny the abuse even occurred or say that, oh, it wasn't that bad, you know, don't worry about it, that really wasn't a big deal. And so there's some sort of apology or some sort of way of sweeping the incident under the rug. And then what usually happens after that is the calm phase. The incident is forgotten. There's no abuse taking place. This is sometimes what you may hear as the honeymoon phase. And so the abuser may bring flowers, they may be wonderful, they may be showering the victim with love, or it just may be a regular day, right? The communication is fine, there's no violence, everything is going okay. And so a lot of times we may think, well, why does a victim stay in a relationship if there was tension, if there's an argument, if there's abuse? And it's a lot of times it points to this calm phase, because in this calm phase, the relationship is quote unquote normal. Nothing bad is going on. And this is usually why the two people are together in the first place, because, you know, they get along nicely. So a lot of times the survivor or the victim may feel like, well, you know, I know that this incident happened, but everything's fine now, and the person is going to get help, and I can help them be a better person. It usually takes a victim 6 to 7 times for this cycle to go forth before they are finally realizing that they do need to leave the relationship permanently. So I want to talk a little bit about the effects of domestic violence on children. Of course, we know that there is child abuse. However, domestic violence between intimate partners can also have a tremendous effect on children, even if they're just witnessing it. So this could look like the child having frequent nightmares. If they're younger, it may be fear and anxiety, not about the parents per se, but just about life in general. fear and anxiety of leaving the house, fear and anxiety of coming home or interrupting their schoolwork. The fear and anxiety just kind of lives in the child because their home life is so unstable. Younger children may revert to an earlier stage of development that could look like a preschooler or a kindergartner sucking their thumb again or wetting the bed again. They're reverting back to earlier stages of development as a coping mechanism to deal with the abuse that's happening at home. The child may feel guilty or believe that the abuse is their fault, especially if the fight was framed around something the child did. They may feel like I caused the abuse because I didn't put my toys away or because, I was crying because I was upset. Poor school performance, that can definitely happen. And then they may also have difficulty with attachment. That could be attachment to both either the victim or the abuser, or to another trusted adult, to a teacher or to a coach or to an older sibling. So I spoke a little bit about why people stay in this relationship, and I really want to change the conversation to why do people stay in a relationship to why does the abuser abuse? But a few years ago, actually many years ago now, there was a campaign that started on Twitter called Why I Stayed after a story came out about a football player who assaulted his fiance at the time, and it was on camera and was broadcast. And these are some of the things that people tweeted out in terms of why they stayed in a relationship. I stayed because I was halfway across the country, isolated from my friends and family, and there was no one to help me. My mom had 3 young kids, a mortgage, and a part-time job. My dad had a full-time paycheck, our church behind him, and bigger fists. Because if I can't have you, no one will have you, was reinforced by my abuser daily. So why do victims stay? They stay because of fear. You just heard that an abuser told the victim that if I can't have you, no one can have you. They have those threats every day. If you leave, I will kill myself. I will kill you. I will hurt the children. They have this fear because of what the abuser has put in them. They may be isolated from friends and family. One of the ways that domestic violence kind of happens is because the abuser may take the victim away from their loved ones, away from their family, away from their friends. They may say, you know what, I don't like your friends very much. Let's not hang out with them. Your family doesn't understand our relationship. I don't want us to hang out with them anymore. They may delete contacts from that person's phone. They may have them move across country or move to another town where the victim may not know anybody in order to be able to isolate them to further control what they do in their lives. Victims may stay because of the children. They may stay because they don't want to break up the home. They may stay because they are afraid that if they divorce the abuser and the abuser gets joint custody, that they won't be able to protect the child if they aren't there. They may stay simply because they still love the abuser. No matter how bad the abuse is, there is sometimes still a good part of the relationship and they want to hold on to that. Financial abuse is a huge reason why victims stay. They may not have any money to their name. They may not have any property to their name. They may not be able to own a car. And so they don't know where they would go or what they would do if they left that relationship because they wouldn't have any financial security. Cultural and religious reasons are a huge part. There may be language barriers or immigration status. Somebody may be here based on their abuser's immigration status or visa status, so they're afraid that if they leave them, they will have to go back to their home country. They may believe the abuse is normal. They may have grown up seeing it in their own family, so they think, well, this is what a relationship is. If they are in a same-sex couple, they may fear being outed by the other person if they're not outed to the larger community. They may not want to leave because of embarrassment or shame or low self-esteem or if they have a disability and they're dependent on the abuser helping care for them. And the most dangerous time for a victim to leave is when the most dangerous time for a victim is when they do try to leave. That's when those threats of, if you leave, I'm going to hurt you, I may kill you, I may kill myself. And so they, of course, don't want that to happen. And so they stay in the relationship and try to endure the violence so that nothing lethal happens. So let's talk a little bit about some warning signs you may see in somebody who may be in an unhealthy or an abusive relationship. You may notice that they are anxious a lot of the times, or they're fearful. They're sensitive about their home life. You may be out with them or talking to them, and they're preoccupied with making sure they're answering the texts from their abuser, or checking their phone all the time so that they don't anger their abuser, or they don't want to talk about what's going on at home. They may be apologetic or defensive. They may say, oh, you saw them, scream at me, but that's just because they had a hard day at work and it's not a big deal, right? They're making excuses for how the abuser is acting. You may see that they've given up things that they used to enjoy, right? They've stopped doing their hobby, or they've stopped going out with friends and family. Also, they may spend less time with friends or family. They're constantly worried. You may notice that their weight or appearance have changed. They're dressing differently. They may have gained a lot of weight or lost a lot of weight. Of course, you may see injuries. You may see bruises. You may see scratches on them. And then you may also see them being very critical about themselves. Let's talk a little bit about warning signs of the abuser. You may see them being extremely jealous. They may be calling them or texting them all the time to make sure they know what they're doing. They may be controlling. You may see them have an explosive temper or make false accusations about how the victim is acting. They may be blaming others for their own behavior. You also may see them be physically violent. You may see them grab the victim's hand roughly or push them. And you may also notice that they're very possessive about the other person. In addition to all of these, you also might see that this person is extremely charming. They are trying to win you over. They may be very helpful. They may be funny. They may be smart, a leader in the community that everybody respects. And this, again, is another way of controlling their victim. Because if everybody else in the world thinks that they are this amazing person, and then the victim comes forward and says that this is an abusive relationship, the abuser is going to use that and say, well, no one's going to believe you. Everybody loves me, right? No one's going to believe you. Everybody thinks I'm a wonderful person. I'm so helpful. I'm a pillar in the community. So they're using that, again, as a way to control the victim. So what can you do? The most important thing you can do, and I know this sounds counterintuitive, is that you can't tell them what they should do. It's not a good idea to say, leave the relationship, get out of the relationship. Because what happens is in a relationship is that the victim, all their power and all their control is taken away from them. And so for you, even as a friend, even as a loved one, to come in and say, leave this relationship, you are also telling them what to do. You are trying to control what they should do. And so the most important thing is to be supportive, to listen to them, and listen to what they're ready to tell you. Don't force them to tell you anything. They will come to that on their own. So just say, I'm here for you. What do you need from me? Believe them, of course. Give him or her time to open up. They may tell you parts of their story in pieces, and just give them time to do that. Of course, don't make victim blaming statements. Don't say, oh, well, they probably yelled at you because, you said you were going to make this for dinner and you didn't. Don't make any type of victim blaming statements. There's absolutely no excuse for abuse. Ask them how you can help. It could be, what? Would you like to talk? It could be, would you like me to find what the resources are in the community? Would you like me to come with you to the Family Justice Center? Whatever it is that they're ready to do, then be there for them. But again, like I said at the beginning, refrain from telling the victim what to do. And then we'll be talking about the Family Justice Center later in terms of the services, but just remember that you cannot rescue them. So how can you talk to the abuser? Let's say your friend or your family member is the abuser. So you want to approach them when they're calm. Don't try to address this after you've seen them have a fight with the victim. Try to approach it to them when it's a neutral time. Be direct, be firm and clear about what you have seen. And focus on the behavior. Don't focus on the person, but focus on what you saw happen or what you heard happen. Tell them that the behavior is their responsibility. They're going to try and deflect. They're going to say, oh, well, I just did that because whatever they may say. Focus on the behavior and tell them that the way they act is their responsibility. Avoid making judgmental comments about them as a person. Again, focus on the behavior. And don't validate their attempt to blame others for that behavior. And never argue with them about their abusive actions. Now, I know that this was a very, very quick overview of what domestic violence is. If anybody is interested in a longer version of the dynamics of domestic violence, please email me. My contact information will be at the end, and we're happy to set up a separate training to go more into detail about the dynamics of domestic violence. I am now going to pass it on to my colleague, Tom Mannion, who is the director of the Family Justice Center. So, one moment while I give him control. All right. So Tom will now be sharing his screen.
All right, good evening, everyone. Smita, is the audio working? Can you hear me?
Yes, I can.
Fantastic. Okay, so good evening, everyone. Again, my name is Tom Mannion. I'm going to be taking the rest of our presentation this evening. I am the director of the Family Justice Center in Montgomery County. The Family Justice Center is, for those of you who don't know, is really the central hub for domestic violence services in our county. And it is run or administrated by the Montgomery County Sheriff's Office. So I'm very grateful to be here with you this evening to be talking to you all about this important topic. So, you know, whether you're here because you work in this field, or whether you live in Montgomery County or you don't, or if this is just an important topic to you, or whether you might know someone, or whether you just have some questions about this topic, I hope you're going to find this presentation informative. And of course, if you have any questions throughout the presentation, you can feel free to use the chat function. We'll also be taking some questions at the end. And then, of course, Smita and I will have our contact information available at the end of the presentation as well, so you can always get in contact with us. So Smita did a fantastic job going through sort of the dynamics of domestic violence or intimate partner violence. What I would like to do now is change gears just a little bit and talk about how the COVID-19 public health crisis has made an impact on not only victims of domestic violence, victims of intimate partner violence, but on the services as well. So when we talk about intimate partner violence and the COVID-19 public health crisis, basically, I think we can all agree, back in the springtime, back around March, everything that we knew to be normal changed. Everything changed. The way that we go to work, the way that we travel, the way that we get our groceries, the way we go to the doctor, everything changed due to this pandemic. And in the domestic violence field, all of the things that Smita talked about for since the presentation began, all of those factors, all of those issues that are kind of at play, all those dynamics are still they're still accurate. They're still at play in domestic violence situations. But what we found was this pandemic brought in even more dynamics and even more issues, and there are more factors at play. To begin with, I'll go through there are basically four primary changes that we've noticed, or four primary issues that we've noticed. First of all, and this was particularly true during the earlier months of the pandemic, during the spring and summer, when folks were being told to avoid public spaces, told to stay in their homes for a while. You know, our county, along with most of the nation, most of the world, was on lockdown. People were being encouraged to stay at home. Now those lockdown orders have been lifted, but people are still being encouraged to stay home and only go out when really necessary. Now, what does that mean for a victim of intimate partner violence? Well, someone who is in a dangerous situation at home, sometimes the only escape they have from that violence, or sometimes the only way that they can reach their support system, is through these excursions into public, whether it's to go to the store or go see a friend, or take part in a hobby, or taking some kind of a class or educational program. And so what we're finding is that for victims of intimate partner violence, their support systems have been cut off. They're being cut off from those systems where they could potentially reach out to people, or where friends could potentially see that something is going wrong and maybe provide them some assistance. Additionally, the second factor that we're seeing is that as a response to being told to stay at home, we're being told to switch to more electronic forms of communication, such as right now. We're here on a virtual platform talking about intimate partner violence and this really important topic. But I'm sure a lot of you have experienced in your, whether it's at the workplace or talking to friends, you're relying a lot more on virtual communications, video chats, Zoom calls, virtual meetings, teleconferences, all of those things. And that's a really great solution for being told to stay at home and only go out when necessary, just like staying at home is a great solution for medically not spreading a very contagious virus. However, again, we've got these unintended consequences. The reality is that for victims of domestic violence, most of the time, the vast majority of the time, and what we see most often at the Family Justice Center, is someone who is being abused, their cell phone, their computer, their tablet, their laptop, those electronic devices are usually compromised in some way or another, whether their abuser can access their phone anytime they want, whether they have their password to their phone or their password to their email or passwords to social media accounts. So again, with these first two, we're staying at home, we're relying on more virtual forms of communication, but for victims of violence, home is the most dangerous place to be, cut off from the support system, and the modes of communication that they do have are often compromised and not safe for them to use, or at least not confidential from the abuser. Additionally, abusers are going to be able to use this scenario, this entire public health crisis, to their advantage, to further control and manipulate their victim. What do I mean by this? They can withhold necessary items such as hand sanitizer or disinfectants. They could spread misinformation. We all hear things about, fake news or propaganda. And, especially in this town so close to Washington, D.C., we kind of talk about that with a bit of a chuckle. But the reality is that when someone is isolated in their home and their only source of information might be this other person, this abuser, they can really use misinformation tactics to instill fear or instill additional fear in some cases in their victim, and use that fear to their advantage to further manipulate and control. They can threaten to cancel medical insurance. We've actually seen this a lot. We've had a lot of folks come to the Family Justice Center very concerned that they would not, if they were to catch the COVID-19 virus, that they would not be able to seek treatment because their abuser was kind of using their medical insurance or their lack of medical insurance as a tool of manipulation, hanging it over their head, saying, well, if you get sick, no one's going to be able to help you and you're not going to be able to be treated and you're going to die. And then on the part of the victim, so we've talked about how the abuser can be impacted by this. On the part of the victim, they feel continuously isolated. As Smita expertly pointed out earlier in the presentation, part of being in an abusive relationship is that the victim feels isolated and powerless. And this type of situation, this pandemic situation, where there is a lot of very real fear and misinformation going around, potentially, the victim is going to feel even more isolated in their home. In terms of services that are available, how many times, especially earlier in this pandemic, have we attempted to go to the grocery store or gone to get food at a restaurant only to find out that that place is closed or that office is closed, or trying to go run an errand only to find out that the errand we need to run is at a place that's operating on reduced hours. It's very difficult to get this information out to a wide audience in terms of operating status. So many victims who have come to the Family Justice Center during this time have said that, they either delayed coming out to the Family Justice Center, or they didn't want to come at all because they weren't sure we were open. They didn't want to risk going outside, and they didn't want to risk their abuser finding out that they were seeking help only to arrive and find out that we were closed. Fortunately, the Family Justice Center has been open for the entirety of the pandemic. I will get to a little bit more detail about that a little bit later. But so we've really talked about 4 factors that have really changed the dynamics, or in this case, really complicated the dynamics of intimate partner violence throughout the COVID-19 public health crisis. People are being told to stay at home. They're told to rely on technology. Abusers have more opportunities to control, and victims are feeling more isolated, and they're concerned that services are not going to be available because they'll be closed. When you add that to all of the additional stressors that are impacting everyone during this really difficult time, financial stressors, people are losing their jobs, family stressors, when you're cooped up in a house with the same people without being able to leave, there's going to be some interpersonal dynamics and interpersonal difficulties going on there as well. So when you put all of that together, it really just creates this perfect storm of horror for someone who is in an abusive relationship and for whom home is not safe. So this is the problem between what Smita has said and what I've just pointed out here, which has been complicated by the pandemic. This is the problem that we face. This is what the Family Justice Center was built to address. And so what I'd like to do is talk a little bit about how you can help someone who might be in need, and then we'll talk about some of the resources that are available, particularly through the Family Justice Center. So if you are on this training, this webinar, and you are worried about someone, continue to reach out to them by phone or computer if it's safe to do so. Like I said, sometimes, or a lot of the times, phones or computers or social media accounts can be compromised by the abuser. Like Smita said previously, I just want to reiterate, be judgment-free, be supportive. Don't tell them what to do. Don't tell them that they're wrong or they're stupid or they're not doing the right thing. Create a safety plan. I say this with a little bit of trepidation because a safety plan, if I were to capitalize safety plan, there is a very specific, when you're talking about the domestic violence services field, a safety plan is a very specific plan or document that folks at the Family Justice Center, advocates at the Family Justice Center, can help someone create and go through. But what I mean by this type of safety plan is really just kind of an emergency plan. So telling someone that they should have a phone accessible at all times if possible, and hopefully know what numbers that they can call for help, whether it's calling a service provider or calling a trusted friend or family member. Developing a signal. Sometimes people will be in a dangerous situation at home and their neighbor is aware of kind of what's going on. If your neighbor is in danger, maybe develop a signal or a plan. You know, if they're flashing the lights or if they text you a certain code word or something, that can signal to you that they're in trouble and they need you to call for help. Also let them know that it's a good idea to keep a bag packed. You never know when a victim of violence is going to get that lifeline that tells them, I need to leave and I need to leave right now. And that's much easier to do, and they're much more likely to follow through with it if they have secretly packed a bag with important documents, a change of clothes, medications, and things like that. So that's always a good idea, again, if it can be discreet. And of course, most importantly, you want to know what services are available. Anyone who is going to be of assistance or be a lifeline to someone who's suffering from abuse, the best thing you can do is know what services are available. So here's a list of services here. Again, the Family Justice Center, we've got a phone number. We also have a discreet, safe email account that folks can use to connect with one of our advocates. We're open Monday through Friday, 8:30 to 5. The Montgomery County Crisis Center is fantastic assistance with crisis situations and shelter. They're open 24 hours a day, 7 days a week. Additionally, the District Court Commissioner's Office also open 24/7. This is where you can go to obtain protective orders. And then, of course, the National Domestic Violence Hotline. If you're not in Montgomery County, or if you do not want to call the Family Justice Center or the Crisis Center, no matter where you are in the country, you can call that line, call, text, or chat to that line, and you'll be connected with local emergency services. So I'm just going to talk very briefly, I know we're running out of time, but I'm going to talk very briefly about the Family Justice Center model. This is the model that Montgomery County has really decided to go with in terms of providing services to victims of intimate partner violence. The U.S. Department of Justice has labeled this model as a best practice. The model started in San Diego in the early 2000s with the whole idea behind it being that there's no single agency or program working alone that can meet all of the need of an intimate partner violence victim. There are so many factors at play, there are so many different dynamics that there's no singular program or agency that can do everything. And so what we decide to do here, or what this model is all about, is taking all of these different service providers, whether they're government, nonprofit, or whatever the case might be, have them work collaboratively under one roof, co-locate them in one space, and have that space serve as a walk-in facility for victims and their children to receive services. And so that's what we did here in Montgomery County. I'm going to be going through a little bit of information about our center. You'll see some photos. All of these photos were taken on site at the center. So we opened in 2009. We're located in downtown Rockville, walking distance to the Red Line, DC Metro, as well as several bus lines. And we are open Monday through Friday, 8:30 to 5. We serve any victim of intimate partner violence. Obviously, if someone lives in Montgomery County, they are eligible for our services. Even if they don't live in Montgomery County, if the abuse occurred in Montgomery County, they are still eligible to receive assistance from us. Now, if someone comes in and they are not a county resident and the abuse did not occur here, that does not mean we're going to turn them away. We're going to make sure that they get connected with the correct people. Additionally, juveniles do require parental consent. This is actually a little bit out of date. I can tell you that we can work with folks as young as 16 without parental consent. We serve folks of any gender, any sexual orientation, and regardless of immigration status, race, religion, ethnicity, or language. The Family Justice Center in Montgomery County has served more than 12,000 people since we opened in 2009. We serve between 1,600 and 1,700 unique individuals per year, many of whom return for additional services throughout their time with us. The hallmarks of our center: we are a secure facility. We do have security and security guards. Accessible, we make sure that we are accessible to all folks regardless of language. And we make sure that we are accessible through transportation. We're near public transportation. We have a taxi cab program so that if someone has transportation issues, they can certainly, we can call a cab to either bring them to the Family Justice Center or cab them from the Family Justice Center to another safe location. Our facility is family friendly. We have a playroom for children available. We are client driven, like Smitha said before. It does not really help to tell someone what they need to do. We need to encourage them to take their power back. And so that's what we do at our facility. We encourage people to choose their path forward. And of course, all of our services are free. No one pays any money for any of the services available at our facility. We have a great team of domestic violence client assistants. They are the primary point of contact for everyone who walks into the FJC, no matter what services a person is taking advantage of. They will be connected with one client assistant who really just serves as the central hub for all of the different services that this person is going to receive. Whether they're receiving legal assistance with a civil case, a protective order, criminal case, criminal investigation, therapy, career counseling, no matter what, they're going to have one client assistant that's going to hold their hand through the entire process. Legal services offered. We offer immigration legal services through a great nonprofit called Catholic Charities. Criminal legal services through the state's attorney's office and the police department, working really collaboratively on criminal investigations and prosecutions. And then we have a whole host of nonprofits who work with civil legal services. Anyone who gets a protective order, we're going to try to match them up with a free or pro bono attorney so that they have legal representation when they show up for their protective order hearing. Therapeutic services at the Family Justice Center. These are more long-term services that are equally as essential as those immediate short-term safety concerns. So we have the Abused Persons Program through Montgomery County Health and Human Services, as well as several nonprofits who provide free therapy services for both adults and for children. We also offer career counseling, referrals to emergency shelter, referrals to the crisis center, basic needs assistance like food and housing assistance. And for those folks, Montgomery County is a very diverse county. For folks who need assistance that is culture or religion specific, we have groups that can provide that as well. And of course, services for children. We work very closely with Child Welfare Services and the Treehouse Child Advocacy Center for any children who have either witnessed abuse or been abused themselves. We also have the Safe Start program, which is a free therapy program for kids who have been exposed to domestic violence in the home. Changes during the COVID-19 public health crisis. So the Family Justice Center has remained open throughout the entirety of the crisis. We did not close. We remained open. We kept all of our original operating hours. We did put social distancing protocols in place. All staff are required to wear a mask. Anyone entering the building is required to wear a face covering that covers their nose and mouth. Many staff who work at the Family Justice Center are working on a rotating telework schedule, but that has not impacted our services. We are still able to provide the exact same level of services as we have been prior to the pandemic. Many of our partner agencies, again, like Catholic Charities, House of Ruth, the Jewish Coalition Against Domestic Abuse, all of them are still providing their services, but what we're able to do at the FJC is facilitate remote sessions or facilitate virtual sessions so that people can still receive services, but they're not under the burden of having to coordinate these electronic or virtual services from their home or using their own devices, which they may or may not have. And then again, if you or anyone you know is in need of assistance, here's the address for the Family Justice Center, again, downtown Rockville, as well as our phone number and a SAFE email account, safe@montgomerycountymd.gov. Of course, if it's after hours or on the weekend, you would want to call the Montgomery County Crisis Center at 240-777-4000. And I believe we have just a few minutes here for any questions that anyone might have. I know Smitha was monitoring the chat if anyone has any questions.
I did just want to note that you all will be receiving an evaluation for this training in your email. We would love to hear your feedback on how this training was for you, because we want to make sure that the information that you want is getting to you, and so that we can improve our trainings to the best of our abilities.
All right, so it looks like we do not have any questions in the chat. So if you do have a question, or if you think of a question later, or if you had a question and just weren't comfortable asking it in this type of public forum, here you'll see on the slide both of our names and both of our contact information. Please feel free to reach out to myself or Smita, or call the Family Justice Center if you have any questions, comments, concerns, whether it's for yourself, a family member, a friend, a neighbor. No matter what the situation is, we can either answer your question or at least steer you in the right direction.
So I did get a question from somebody. She chatted me privately. Do you all help survivors find someone to supervise visits? So in Montgomery County, there is the Safe Passage Center, which is open currently for monitored exchanges. Tom, do you know if they're doing supervised visitation yet because of the COVID crisis?
I do not know. I know they are doing the exchanges. I don't know if they've moved to supervision at this time.
So on a regular day, they would be able to do supervised visitation and monitored exchanges. In order for their services to happen, you do need a court order, and then all of their services are free of charge. However, Tom, do you know if anybody else is doing supervised visitation right now, given the COVID-19 crisis?
I'm not sure. We have a contact at the Safe Passage Center, so so Smita, if that message was sent to you privately, if you can just get contact information, we can follow up
Absolutely.
with that information. I know that they were gearing towards going to be fully open. I don't know if that has fully happened yet, or if they're kind of rolling it out, but we can certainly get that information by tomorrow at the latest.
Okay, great. And then for those of you who don't know about the Safe Passages Center, it's a center that was opened up a few years ago to make sure that couples with families who are no longer together, that there is a place for them to safely either exchange for custody or to have supervised visitation by a trained monitor, given any history of family violence. And so they have a very nice center set up in Rockville with different playrooms. They're all themed by different woodland animals. And it was something very important for the community to have in general, so that there was a safe place for people to exchange their children instead of meeting either at somebody's house or at a McDonald's. This made sure that it was done in a safe way, where there are two separate entrances, one for each parent or guardian to come in, drop the child off, and for the other person to pick up the child without them having to communicate with each other.
All right. Okay, so if there are no more questions, I think we will leave off here. Thank you all so much for joining us this evening to talk about this really important topic, and I hope you found it useful. And again, if you have any questions for myself or Smita, please feel free to reach out. And if you or anyone you know is in need of assistance with a domestic violence situation, please reach out to the Family Justice Center and/or the Crisis Center. Again, thank you for your attention and have a great evening. Take care.
Thank you, everybody.